Anxiety disorders can be crippling. Thankfully, there are ways to improve your anxiety. Let's talk about 3 ways to treat your anxiety and also tips to help you cope with this condition. Hi, my name is Dr. Ed, board certified psychiatrist and lifestyle medicine physician. About 260 million people suffer from anxiety disorders worldwide. It is one of the most common mental health disorders. But what is anxiety? I think it is important to know that anxiety is a normal emotion. We all feel anxious now and then. For example, you may feel anxious before writing a big test or giving a presentation. Anxiety disorders, on the other hand, are different. These are a group of mental illnesses that cause constant and overwhelming fear and anxiety. This excessive fear can make you avoid school, work, and other social situations. Some common symptoms of anxiety disorders are fear, sleep problems, restlessness, shortness of breath, heart racing, dry mouth, tense muscles, dizziness, mind racing, and difficulty concentrating. Scientists don't know exactly what causes anxiety disorders, but it is known that genetics, environment, drugs, and medical illness play a role. Some conditions can also make you more likely to develop anxiety disorders. Examples are having another mental disorder like depression. Trauma, negative life events, stress, drugs, and low self-esteem are also risk factors for anxiety. Anxiety disorders can cause you to struggle with life. The good news though is that there are treatment options. Let's talk about 3 ways to treat your anxiety disorder. The first is with medications. The most common medications used to treat anxiety disorders are antidepressants. SSRIs and SNRIs are types of antidepressants, and these are the most common for treating anxiety. Examples of SSRIs are sertraline, escitalopram, and fluoxetine. Examples of SNRIs are duloxetine and venlafaxine. Benzodiazepines like clonazepam and lorazepam are sometimes used for treatment but should be used with caution as they can be addictive. Other medications that can be used for anxiety disorders are buspirone, imipramine, hydroxyzine, and propranolol. Treatment with medications is usually for about 6 to 12 months but may be for several years or even lifelong. Studies show that approximately 25% of people develop anxiety again in the first month after they stop treatment. About 60 to 80% develop anxiety again within the first year of stopping treatment. So we just talked about the first treatment for anxiety disorders, which is using medications. The second one is psychotherapy, also known as counseling or talk therapy. Psychotherapy helps you learn how your emotions affect your behaviors. It explores your thoughts and feelings and suggests ways to cope and deal with the anxiety disorder. Cognitive behavioral therapy, or CBT, is a common type of therapy for anxiety disorders. It teaches you how to transform negative and anxiety-causing thoughts and behaviors into positive ones. So we've talked about medications and psychotherapy. Number 3 is social support. As you know, life can be stressful. Issues related to work, school, finances, and relationships can worsen your anxiety. Getting help from family, friends, and support groups can go a long way to help you cope with your anxiety. Studies show that people who have close, supportive family members and friends have less anxiety. Connecting with loved ones in person, over the phone, or computer can help your anxiety. Medications, therapy, and social support are the 3 main ways to treat your anxiety, but let's talk about some other tips. Learning about your anxiety disorder also goes a long way to help you cope. The more you know, the better you'll be able to deal with it. Sleep is crucial for your well-being. Sometimes your anxiety can make it challenging to get good sleep. You want to ensure you engage in sleep hygiene to get proper rest. Studies show that exercise helps with the natural release of brain chemicals called endorphins. Aerobic exercises like jogging, swimming, and biking can help improve your anxiety. Drinks that contain caffeine include coffee, tea, energy drinks, and soda. These can make your anxiety worse. Cutting down on such drinks can improve your anxiety symptoms. Avoiding alcohol and street drugs is also beneficial. Another essential tip is stress management. Finding ways to minimize your stress and unwind will help your anxiety. Some people find mindfulness, meditation, and yoga very helpful. Journaling can be beneficial. Writing down your thoughts helps you get them out of your head so you don't keep ruminating. Even if anxiety disorders can be frustrating to live with, getting the proper treatment can improve the quality of your life. So get the help you need today. Thanks for listening, and don't forget to subscribe.